Ladies and gentlemen, dear colleagues, dear compatriots, my name is Chaltikyan. I'm a professor and head of digital health at Deggendorf Institute of Technology, a university in Germany, as well as at Russian-Armenian University in Yerevan, Armenia. And I'm also the founding president of the Armenian Association of Digital Health. And it is both a great pleasure and an honor to address the audience of the sixth International Medical Congress of Armenia. So I thank the organizers of the Congress, as well as the host and the respected panelists for giving me an opportunity to address you with this short keynote. We all know that health systems around the world are facing significant challenges in providing quality and affordable healthcare, challenges related to the aging populations, with elderly people living with one or more chronic conditions, challenges related to epidemics and other public health emergencies, to growing health spending, which has reached $11 trillion in 2022 and continues growing at a pace that is faster than the growth of economies, to the shortage of health workers, to the burnout of health professionals, leading to the massive workforce outflow, to fundamental flaws in structure, funding, and governance of health systems around the world, as well as on the other side, to the growing expectations of informed citizens and consumers. And it is considered that digital health could provide at least some answers to many of these challenges. And so this is not a surprise that digital health has become a hotspot of policy, practice, research, and innovation recently. I would like to address a few conceptual definition issues on these slides related to the differences between the terms digitization, digitalization, and digital transformation, where digitization is simply converting any analog-based data object into digital, such as scanning a printed document to a PDF, or digitalization being managing data throughout the organization through digital technologies. So it leads to changes in the business processes and result in new business models, while the digital transformation is the fundamental change in the strategy and practice of the entire industry or the entire society. So we digitize information, we digitalize processes, business processes, and roles that make up the operations of a business, and we digitally transform the business and its strategy, the entire sector. Each one is necessary but not sufficient for the next, and most importantly, digitization and digitalization are essentially about technology, whereas the digital transformation is more about the customer and the culture change. So with regard to the most recent developments in digital health around the world, we all have been watching quite significant developments with the growth of telemedicine adoption that grew approximately 700 times in some areas in some nations around the world during the COVID-19 pandemic, with mobile health, digital therapeutics, and sensor technologies. Of course, it's impossible to speak of digital health nowadays without mentioning the artificial intelligence revolution, especially with the most recent developments with the large language models and GPTs, something that leads to the so-called combinatorial explosion. And we're facing further developments with digital twin, collecting and analyzing real-time health and wellness data that is supposed to eventually bring about our vision of the future of healthcare, something that I like to refer as to 10P healthcare: predictive, preventive, personalized, precision, participatory, pertinent, proactive, pervasive, permanent, and platform-based care. There has been a lot of policy support endeavors recently very prominently by the World Health Organization and especially by the WHO office, regional office for Europe, that I have had honor and pleasure to be consultant for and to take part in some of the recent publications of WHO Europe. And importantly, and there was one of the prominent moves by the WHO European office very recently in September 2022. It was the adoption of the very first draft regional digital health action plan for the WHO European region for 2023-2030. And that plan is based on 5 guiding principles to place the individual at the center of trustworthy care delivered digitally, to understand the health system challenges, acknowledge needs and expectations of citizens and health workers, to recognize the need for policy decision-making, to leverage the digital transformation, and to recognize that institutionalization of digital health requires long-term commitment. With regards to that, ladies and gentlemen, I would like to briefly describe the Armenian Digital Health Initiative that our association and our team, my colleagues and I have been working on in the past nearly 3 years. And just 3 months ago, we published a policy paper, an action plan and operational blueprint for digital strategy, digital health strategy for Armenia, a work that was supported by Armenia and Chaltikyan Fund. So this initiative is actually about improving the life of people in Armenia through large-scale economic and social advancement strategy that is driven by digital health. The initiative is structured around 3 pillars, being firstly, the education, research and development in digital health. And as a part of that strategy, I'm happy to also announce and to let you know, dear ladies and gentlemen, that last year we were able to launch the very first master's program, Master of Digital Health at a Russian Armenian University in Armenia, which is operated as a double degree program jointly with the Deggendorf Institute of Technology here in Germany, where I am employed. Second pillar is the applied health system, which is about essentially developing this integrator platform for health data in order to advance health services in the country. And the third pillar is the business and entrepreneurship development. We are right now completing the establishment phase of the initiative and looking forward to moving it further. I would also like to call all colleagues and everybody who is interested in advancing digital health in Armenia and worldwide to visit the website of our association, and if interested to become a member, to join our community and network of digital health specialists and professionals that are concerned and interested in advancing digital health in Armenia and worldwide. So these are basically on this slide, you can see the extract from our website presenting the 2 key recent developments by the association, this master's program that I've mentioned, as well as the Armenian Digital Health Initiative. Ladies and gentlemen, thank you very much for this opportunity, and thank you for listening to this short talk, short presentation. Please do connect with me. You see here my email address, as well as those of you who might want to connect with me on LinkedIn. Please just point your cameras to this QR code. Find my profile on LinkedIn. I will be absolutely happy to initiate a dialogue with each and every one of you in relation to development of telemedicine and digital health in Armenia. Thank you very much for your attention.